to get the data we need to understand this disease and to ensure proper care for our residents who are sick. I'm glad to report today that we've seen a continued interest in the 2 new testing sites that have opened yesterday at Midtown and UMOS. Both of these sites are offering free tests whether you're symptomatic or not. And due to the significant response, the Midtown location has reconfigured to accommodate traffic flow and capacity. So the interest location is now at 5825 West Hope Avenue, which is right by Culver's. I'd like to also give a special thank you to the Wisconsin National Guard, who is helping to expand our local capacity for testing. And for individuals who are experiencing COVID-like symptoms, I want to remind you that there are 17 total testing sites available throughout Milwaukee County. All 5 community health centers and many of our private healthcare providers are offering testing. So if you need to make an appointment, please call 211 to get connected to these testing sites. But I also want to make sure that we are talking about wearing masks. And we're going to be focusing the bulk of this briefing today on the importance of wearing a mask and covering yourself to protect yourself and others from COVID-19. Now, the best thing that you can do to protect yourself are practicing proper hygiene and ensuring physical distancing. But if you have to be around others, it is extremely important to wear a face covering. Health experts today will talk about how to properly wear a mask and address some of the myths and facts about them. But I do want to address an elephant in the room. We know it can be a significant risk for people of color to wear masks. There's a long history of bias in this country, and that can make it unsafe for people of color to cover their face. And I just say that because I have 2 masks. I have a black mask and I have a white mask. And I get different reactions when I walk into different places. And I wanted to make sure that we address that to make sure that everyone in this community feels comfortable taking the precautions that they need to take in order to keep themselves safe from the novel coronavirus. So we also want to make sure that everyone checks their biases at the door when they see someone wearing a mask and understands that we are all in this together. The virus doesn't discriminate, and neither should we. We want to put this message out there proactively so that we can unite one Milwaukee County. We need to protect the dignity of everyone in this community, and we need to make sure that we're keeping everyone safe. I want to share some of the things that we're doing here in Milwaukee County as it relates to masks to make sure that our employees and our public is protected. We're working to provide more services digitally and retrofit our space to ensure we can meet physical distancing guidelines and get personal protective equipment such as reusable masks for all of our employees. I'm pleased to share that we have also ordered 15,000 cloth masks that we will be distributing to our employees, contractors, and service users. And as we turn the dial and reopen many of our buildings, we will follow state and local public health guidelines and recommendations from the CDC to be diligent about protecting ourselves, our workforce, and the public. Thank you for your time, and I'll hand it over to Mayor Barrett.
Thank you very much, Mr. County Executive. And as the County Executive said, the reaction to the new sites at Midtown and at UMOS have been phenomenal. The fact that yesterday we had over 1,900 individuals who either drove up or walked through the site tells you just how much pent-up demand we have had to have these community-wide testing locations. As of 2 o'clock today, we had 660 people who were tested, who've been tested at Midtown today already, and over 600 at UMOS on the south side. So I would not be surprised by the time we get to closing time tonight at 8 o'clock that the numbers from yesterday will be equaled, if not surpassed. All this leads to our conversations as to how long these sites should remain in operation. And we've been in communication with the National Guard because they have told us they'll continue to work with us as long as the demand is there. Right now, we're looking at having them certainly through Saturday. What we originally had announced was that they would be open Sunday, but given the incredible amount of work that they're doing, Sunday they will not be open. We have to give these people a break. The people who are doing all the testing, they're human beings too. In fact, I think that's a point worth making, that the people who are serving us in the National Guard, they have families, they have day jobs, they are in essence citizen soldiers who have signed up for the National Guard. And this is not something they ever contemplated they'd be doing, but their response to our requests and the state's response to our requests have been phenomenal. So we're very, very thankful for this. We continue to look at the other community sites that we have out there. When I say community sites, the community health centers, the hospital systems are setting up sites. Right now, we've got approximately 17 other testing locations in Milwaukee County. Those testing locations, of course, are for people with symptoms. And by and large, you should be contacting them or contacting 211 before you go to those sites. What's different about the two community sites that we have, the one at Midtown and the one at UMOS, is that you do not need to call for an appointment for those. You do not need to have insurance, and you do not need to be a person who has the symptoms. It will be something that we prefer, of course, people who have symptoms, that they come to these sites or go to the community sites. We also want to make sure that all of those individuals who are in contact with the public, if you have a job or if you're out in the community a lot and you're interacting with people, you are exactly the type of person who we want to have come and have yourself tested for your own good and for the good of the people who are in your family, the people you interact with, the people that you work with. So it doesn't take long. It may take long to get there. When I say get there, the lines might be long, but I think as the week goes by, I'm thinking that those lines will probably get shorter. Again, today we continue to have very, very high demand. I also want to touch on the masks, because I think the masks are something that most of us are not used to. We're not used to wearing the masks. I love to take walks and I love the fresh air, but certainly if I'm going to go into a store of any type, or if I'm going to go to the gas station, or if I'm going to go any place where I'm interacting with someone, I am going to be wearing a mask. And my wife and my daughters love to tease me about my masks, but that's all right. That's all right. Still wear the mask, and you're wearing them not only for yourself, but you're wearing them for other people. And I think that's one of the keys that we have to remember through this entire ordeal, that we're thinking of ourselves, but we are also thinking of other people, because we know that people can be carrying COVID-19 without any symptoms. And we want to make sure that even those people who feel good, who feel invincible, but are still carrying the virus, that they're not infecting other individuals. So please wear the masks, and we're going to continue to get more masks in this community so that people can wear them. In terms of what we're going to be doing in the future with the testing, just to bounce back there, we'll have an announcement later in the week as to whether we will continue at these sites, whether we'll continue with these sites and have additional sites, or whether we move any of these sites. We want to make sure that people in all parts of the metropolitan area have access to this. I would not be surprised at all if we saw additional sites, the National Guard setting up additional sites throughout the metropolitan area. But we know that one of the keys here is to have more testing. And as we see the numbers drop, and Dr. Weston is going to talk about what we have seen, and some good news actually, in terms of a lower percentage of positive rates that we initially thought, which is really, really good news, that it is going to really allow us to move back to normalcy as quickly as possible. And that's the goal for all of us. The final thing I want to say is, had a great meeting this morning with some people who are involved in the salon and barber industry. And we're looking to set up a tutorial of sorts to work with beauty salon operators, with barbers, so that they can feel comfortable as they get closer to reopening as to the steps that they can take, because we want to make sure that they feel comfortable. We want to make sure that their customers feel comfortable, because we know the reality is when you're in a beauty salon or a barbershop, there's basically no way you can get your haircut from 6 feet away. And that's the reality that we're trying to deal with. But a lot's going on, and a lot of great cooperation throughout the community, which I love to see. I want to give a big shout out not only to the National Guard, but to all the people from our health department who have been working, all the police officers who have been there controlling traffic. We've had a great response to having literally hundreds, if not thousands, of people come to these community sites. And that's what makes it a strong community. So with that, I'm going to turn it over to Dr. Weston, and I want to thank him again for all the tremendous work that he's doing. Dr. Weston.
Thank you, Mr. Mayor. Good afternoon. So starting with our numbers, we have 4,193 positive cases and 222 individuals who have died. I'm going to share a screen here briefly. So as you review the numbers on our dashboard, especially under the testing data, you'll see that a large number of tests have been added to our total test down here in the lower left. And there's also been a modification in our percent positives. Previously, there was a bump here. You'll see that in a good way, that's flattened out more as well when you look at the trend of percent positives. So this is due to a number of negative tests that were in a bit of a holding pattern in the state database that we use to populate this section of the dashboard. So We've modified the procedures, so these should be updated and accurate moving forward on a daily basis. But as the mayor mentioned, the changes we see on the dashboard are good changes, with an increase in number of tests performed over the last 3 weeks in light of the opening of our 17 community testing sites. It can be reached for a testing appointment for anyone with symptoms by calling 211. And then additionally, a more gradual and consistent downtrend in the percent positive cases. So a key metric, and to be sure, a promising sign. So as we begin to look toward and plan for a measured dialing back of the stay-at-home orders and physical distancing, there's been a lot of discussions, including here today, around face masks, specifically non-medical cloth masks. So as a reminder, while not a substitute for physical distancing, these masks provide an additional level of protection in minimizing the spread of respiratory droplets. And everyone deserves to have that increased level of safety as they work to protect themselves, their families, their coworkers, and their communities from COVID-19. And we know that there's a long history of marginalization, of discrimination, and racism that impacts, as the county executive mentioned, how safe and comfortable a person of color or an immigrant, a refugee, a person experiencing homelessness feels while wearing a face covering. And as we increase adoption and acceptance of face masks, everyone deserves to be free of the stigma, the bias, and the discrimination that comes when wearing a face covering. We've heard and read cases of and concerns for this type of discrimination, to be sure. So over the past few months, we've all discovered a new normal with physical distancing. And in the coming weeks and months, this will continue to modify. And a new normal of mask wearing will likely be seen, hopefully be seen. And like the county executive and the mayor, I myself wear a mask in public to protect myself and to protect those around me. We must all work together to normalize mask wearing so everyone, so that we can all feel safe. Everyone can feel safe. Everyone can be safe, and we can minimize the spread of COVID-19. Thank you, and stay safe. And I will hand it off to Director Roush.
Thank you, Dr. Weston. I'm delighted to represent the 11 health departments in Milwaukee County today and talk about a number of topics that we've already touched upon a little bit. First of all, for several reasons, we know that testing has been a huge challenge throughout our COVID-19 response and at times has negatively impacted case finding both here in the county and nationwide. Most importantly, now we do have tests available, and it's critical that we get those tests conducted for all people with symptoms, but also, just as importantly, to get testing for people who just want to be tested because they have concerns about their COVID-19 status. Our testing capacity has increased, and this enhanced testing is important to disease control going forward. Not only in addition to the special National Guard sites that have been put up in Milwaukee, we have also seen additional healthcare sites come online in recent days with increasing testing capacity as well. We need this additional capacity to go forward, and we're working consistently with healthcare system and statewide partners to make even more testing available at other sites throughout Milwaukee County. Most importantly, we are tracking metrics, and Dr. Weston had shared a few of these earlier. Several key metrics are moving in the right direction, and this is evidence that Safer at Home is working. Residents, you should be commended for your efforts to follow the guidance that was issued at multiple levels of government. Your way of life has been undoubtedly impacted, and we thank you for your compliance. Please continue to wash your hands. Please continue to cover your coughs. Maintain a physical distance of 6 feet. And as mentioned previously on this call, wear your masks when out in public. It is not only for you, but to also protect others. Please continue to do your part, residents, to stay home and save lives. Thank you.
Thank you, and I'll hand it off to President Montgomery.
Good afternoon, and I want to echo everything that I've heard everyone else say on this afternoon. And I'm just going to reinforce or reiterate the importance of wearing face masks. We know that it's not required, but it's critical for us to help reduce the spread. As others have said today, it's not only to protect you, but also those around you. As we know, this past Sunday was Mother's Day. And although I wanted to spend time with my mother physically, we had to do another Zoom Mother's Day celebration, or we had to do a Zoom Mother's Day celebration. But I've shared before that I wear face masks. We as women, a lot of times we want to be have our makeup on or lipstick and what have you. And sometimes a face mask may not be stylish. But I would say let's use this as an opportunity to model appropriate behavior, not only for ourselves, but for others. So I shared before about face masks that I made myself, but sometimes people might not have that option. You can also just get a $1 bandana and roll it up and make that into a face mask. The other thing I want to share is that sometimes, we use things because it's ours and we use it over and over and think, oh, it's okay. I can just keep using it each and every day. Maybe leave it in my car, like you might leave your sunglasses or other things. What I would encourage you to do is if you're wearing your mask, like we all should be, make sure you wash it every day, hand wash it every day. If it has elastic, you don't want to put it in the washer and dryer because the elastic will wear out. But we want you to hand wash it, hang it up so that it's ready for you the next day. If you have a couple of them, it actually gives you an opportunity to switch off every day. But by wearing the mask, we show that we are supporting, we're leaders in the community. This is something we have to do. It's not forever, but it's certainly for the time that we're spending right now. Last week, as I said, it was Mother's Day, and I go to a local church that we have a number of seniors, mothers specifically, that are over the age of 65. And so I spent some time last week. I think I made about 25 masks, and I put them in the mail to all of the mothers in my own church and sent them out and just said, Happy Mother's Day, because I know that in a few weeks, when some of the stores and things the order might be lifted for people to go out, I wanted them to not have to leave home and try to figure it out, but they at least have one that they can use. So again, we want to encourage you. Let's all play our part. If you don't have a mask, there's so many ways that you can get them. If you have old scarves, I have a scarf on today. And I ran out of the house today to run to the store. And just as I was about to get in my car, I said, oops, I got to go back and get my mask. So let's make it a part of our daily routine. Just like you get your purse, your keys, make sure you have your mask before you leave. And I think somebody said earlier about children. We also need to make sure our children have masks. So however you can facilitate that, if you got a scarf or something that you can put together for our children to also be covered.